When people are having difficulty with rehab, there's often a reason why. And so we don't want to assume that it's some sort of behavioral problem or that somebody might be difficult to work with, because underneath that there's typically some sort of fear or worry. And I think it's important to have good rapport with the patients, and so you can openly discuss any barriers to care. It might be something very simple as the time of day, or it could be based upon fear of moving. And so it's important that we openly talk about these aspects so that we can modify them or address them as needed. And I think that it's important that we have a team approach so that we understand why the patient isn't ready, as much as they're willing to engage in that conversation at that point in time, and having the different disciplines come in and maybe have a team meeting and hear from the patient where they're at, and then use what's called motivational interviewing. And so it's a form of communication where we're eliciting from the person their own reasons to change or move in a direction of health behavior at their own speed. And so making sure that we're all at the same place and we understand any concerns that might be going on so that we can pace with the individual, making sure that they understand that window of care, that some things, especially with nerves, it's very time-oriented so that we can continue to make gains. But as long as we're providing that information and the patient is able to make their own decisions, I feel like that we're at a good point.